Welcome to Learn Medical Spanish. In this dialogue, I'll be talking about how to introduce yourself to patients in Spanish. So, when you first walk in the room and you want to say something to break the ice before you get into the whole medical history or whatever. So here's some of the stuff you could say to introduce yourself. And this is related to some of the content in my CME course. So if you want to see more details about that, just check for the link in your podcast episode description or the YouTube video description. I'm going to start by saying phrases in English and then give you a chance to think about the translation, and I'll repeat it in Spanish a couple times most of the time. In this case, we'll talk a little bit more about which phrases apply to who, which situation, or whatever, as a little bit more of that kind of discussion compared to some of the other dialogues in the podcast or on my YouTube channel. All right, so let's kind of get into the beginning. So the first scenario is going to be if you're a doctor. If you're a physician and you want to introduce yourself to the patient. So we'll do a couple of phrases that are specific to that. So this phrase is, "Hi, I'm Dr. Blank." So your last name, for example. Let's say Smith. "Hi, I'm Dr. Smith." So how would you say that? Hola, soy el doctor Smith. Hola, soy el doctor Smith. And then I have it written there for if it's a woman who's saying it, they'd say soy la doctora, and then the last name. So I just said the male version first for simplicity, but then a lot of these, it depends on the gender. So you'd say soy la doctora, whatever. It might sound a little funny to put el or la in front of doctor, but in Spanish it's kind of common to put that definite article in front of professions. So continuing on, after you introduce yourself, you could say, "What's your name?" ¿Cómo se llama usted? ¿Cómo se llama usted? Of course, you may already know their name, but that's not the point. This is kind of making conversation or just confirming that you're talking to the right person or whatever. So that's why that might be useful. The next one is, "What brings you in today?" ¿Por qué ha venido aquí hoy? ¿Por qué ha venido aquí hoy? Now, the problem with that is it's open-ended, right? So if you don't know very much Spanish, then that's going to be a problem. So we're going to give you an alternative here, which is instead of saying, "Why have you come in today?" or "What brings you in today?" you could say, "Have you come because blank?" Like, in other words, confirming the chief complaint. Did you come because, in this case, I'm going to say your back hurts. So have you come because your back hurts? ¿Ha venido aquí porque le duele la espalda? ¿Ha venido aquí porque le duele la espalda? So if it's a different chief complaint that you're trying to confirm, then just replace that part about le duele la espalda with something else. So if it's pain in a different place, you could just say le duele whatever, el pecho, the chest, el abdomen, the abdomen, and so forth. Now, let's say you're not a doctor, and so we're going to go back to the very beginning. If you're not a physician, you could introduce yourself slightly differently. So, for example, I'm a PA, so I might want to say, "Hi, my name's Ben. I'm a PA." So how would you say that? Hola, me llamo Ben. Soy asociado médico. Hola, me llamo Ben. Soy asociado médico. Couple quick notes on that. One is, yes, you could put the article in front of that, just like we did with doctor. You could say, soy el asociado médico, and that would be totally fine. Basically, it's fine either way. And then the other thing is, if you're a PA or an NP, a physician assistant or a nurse practitioner, then it's never really going to be clear when you introduce yourself to patients. Pretty much they're never going to really know what you're talking about because in Latin America, there's no such thing as PAs, and I don't think they have NPs either. And so those people are just always unfamiliar with those types of professions, and so they're pretty much not going to know what you mean. But that's sort of okay as long as they get the gist of what's going on. I do have a link on the blog version of this dialogue. I have a link to some other resources that talk more about how to say PA or NP in Spanish if you want to look into that a little bit further. So let's just mention a couple other professions. If you want to say like, hi, my name's so-and-so, I'm a blank or the blank, how would you say nurse? Enfermero. Enfermero. And if it's a woman, you'd say enfermera. Enfermera. So just pick the one according to if it's a man or a woman. What about paramedic? Paramédico. Paramédico. And I suspect if it's a female paramedic that you could change it to paramédica. And at least, even if that's not grammatically correct, it would certainly be easy for people to understand. Okay, so I mentioned PA earlier, but let's go over that again. So we'll do PA and then NP. How do you say physician assistant or PA? Asociado médico. Asociado médico. So that's not the only way to say PA, but that's the one I usually use. And usually the patients don't understand, but they wouldn't understand regardless of what you say unless you give them a full paragraph. And even then, they probably wouldn't really get it because I've tried many times, believe me. People just don't seem to really get it because they've never heard of this profession, so they don't really have that concept in their head. But anyway, moving on to nurse practitioner. How do you say nurse practitioner in Spanish? Enfermero practicante. Enfermero practicante. And of course, that's the male version. So if it's female, if you're a female, you would just replace it with enfermera practicante. So for consistency, I'm doing the male version first, even though I know there's probably more female nurses out there. Okay, so we've talked about how to introduce yourself as a doctor, a PA, an NP, or if you're a nurse or a paramedic, you can just kind of insert that word as well. And we asked the patient a couple questions like, are you here because blank, or why are you here? What's your name? So what if you are a PA or an NP and now you want to make it a little more clear what's going on? Maybe they have no idea what you're talking about. Well, you could tell them after you say, I'm a PA, you could say, I'll be in charge of your care in the ER today. So how would you say that? I'll be in charge of your care in the ER today. Voy a estar encargado de su cuidado en la sala de emergencias hoy. Voy a estar encargado de su cuidado en la sala de emergencias hoy. Sorry, I messed it up on the second one, so I'll say it one more time just in case. Voy a estar encargado de su cuidado en la sala de emergencias hoy. So it's a fairly long phrase, and of course that's optional, but if you want to kind of just make it clear, like, I'm the provider, I'm the clinician. I'm the one who's going to be kind of ordering stuff, etc. You could say something like that. All right, so a couple other phrases you could use kind of for getting to know the patient or just making conversation, breaking the ice, etc. are the following. At the end, after you meet them, after you learn their name or whatever, you could say, a pleasure to meet you. Mucho gusto en conocerle. Mucho gusto en conocerle. If you leave out the word en, that would be fine. You could say mucho gusto conocerle. It's not like they wouldn't understand. And they're both kind of grammatically correct, I think. Another phrase would be, how old are you? ¿Cuántos años tiene? ¿Cuántos años tiene? So most of the time I put these questions in usted. That's because unless you're a pediatrician, you're going to almost always be using usted when you talk to your patients. But if you were saying this to a child, then you would change it to the tú form because you would generally speak to children in tú. So in that case, it would be ¿Cuántos años tienes? ¿Cuántos años tienes? With the S at the end. Where are you from? ¿De dónde es? ¿De dónde es? Do you live close to the hospital? ¿Vive cerca del hospital? ¿Vive cerca del hospital? So just some other things you could say if you're just kind of trying to connect with the patient a little bit more. So that's the end of that particular dialogue, and I have a list of some other dialogues. Of course, on the podcast feed, there's a bunch of other ones, but also there's a playlist if you're on YouTube, and also a video that tells you a little bit more about my CME course if you're on YouTube there. And if you're not on YouTube, you can find that link in the podcast episode description. Thanks for listening, and I'll see you next time on Learn Medical Spanish.